Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of pathology, and the subject will be inflammation with the subtopic acute inflammation. So let's start.
Welcome to this examination on pathology. We will focus on acute inflammation. To start, could you describe the main vascular events that occur during acute inflammation? Please remember to consult a healthcare professional for any health concerns, as this information is not medical advice.
The vascular changes in acute inflammation involve immediate transient vasoconstriction followed by prolonged vasodilation, increased blood flow, and heightened vascular permeability. These changes, driven by mediators like histamine, lead to redness, heat, and swelling, edema, due to exudate leakage.
That's right, a very good overview. Now, could you elaborate on the role of histamine in promoting that increased vascular permeability? How exactly does it affect the blood vessels?
The hallmark of acute inflammation is increased vascular permeability, which makes the vessels leaky, allowing exudate and immune cells to escape into the tissue, resulting in swelling. And histamine plays a crucial role in mediating these changes.
You've correctly identified that increased vascular permeability is key. To elaborate, histamine acts by causing endothelial cell contraction, which creates gaps between the cells that allow fluid and proteins to pass through. Now, could you tell me what happens to the cellular elements, like neutrophils, once they leave the circulation? What is that process called?
It's called chemotaxis.
Chemotaxis is actually the movement of cells along a chemical gradient. Before that, the cells need to marginate, roll, and finally adhere to the endothelium before transmigrating out of the vessel. What are some of the chemical signals or mediators that attract these neutrophils to the site of injury? Can you name any?
Yes, it's in interleukin 8 and from the complement system C5a.
Excellent. Those are indeed both very potent chemoattractants. Now, continuing with mediators, what about the prostaglandins? What role do they play in the inflammatory response? Specifically, what are they generated from?
Can you please
Take
answer?
your time. Prostaglandins are derived from cell membrane phospholipids. What is the main effect they have on the vascular system and on pain perception?
Prostaglandin E2 and D2 and F2 alpha are responsible for chemotaxis, and they are helpful in pain perception and vasodilation.
You are correct that prostaglandins contribute to vasodilation and pain perception. However, chemotaxis is predominantly driven by other mediators like leukotriene B4 and those we mentioned earlier. Prostaglandins are particularly known for sensitizing nerve endings to pain mediators and increasing blood flow. Shifting focus a little, what are some factors that could delay the process of wound healing? Can you think of any systemic or local factors?
The process of wound healing can be delayed in case of diabetes mellitus type 2 and decreased blood flow to the part.
Yes, both diabetes mellitus and poor blood flow are significant factors. Nutrition also plays a vital role. Deficiencies like vitamin C or protein can hinder healing. In contrast, how does the healing process differ in a clean surgical wound versus something with significant tissue loss, like a large ulcer? What are those two types of healing generally called?
They are, in case of healing of a surgical wound, it's called healing. It's called
healing by primary
intention. Yes.
What about the other type with significant tissue loss? What's that known as?
It's called healing by secondary intention.
Exactly. Healing by secondary intention involves contraction and more granulation tissue. Now, considering a different scenario, what kind of inflammation is characteristic of a condition like tuberculosis, where you see collections of modified macrophages and other cells? What is that specific structure called?
In case of inflammation in tuberculosis, it's called chronic inflammation, and the collection of modified macrophages and other cells is called a granuloma.
That's precise. Granulomatous inflammation is indeed a key feature. Within that granuloma, What specific term do we use for those modified macrophages that have taken on a pink squamous like appearance? What are they resembling?
It's called foam cell.
Not quite. Foam cells are macrophages laden with lipids, often seen in atherosclerosis. In granulomas, the modified macrophages are called